Live होता ना? Please make it live. Hello guys, can you see me? Can you hear me? Okay, sorry for the technical glitch for a few seconds. I hope I'm audible and visible. Okay, great. So, good evening everyone. Hope you're doing good. So, we're in the second series of Read Robbins with Dr. Ranjith. Amazing, great. So, I hope you guys did make notes for the stem cells, for the cell cycle, what we discussed yesterday. How many of you did make notes after the class? Honestly answer. Good evening, Banana Shake. Good evening, Angel. Hello, Ali Reacts. Hello, Lion. Hello, Nayak. Today, we are going to do the same thing what we did yesterday. I'll be going with Robbins, this topic of stem cells and the regenerative medicine part. Again, is the last part of the Robbins first chapter, which we generally tend to ignore, right? Amazing, Lion. Okay, so here again, we'll do the same thing. I'll read Robbins, what is required for you, and also tell you how to make notes. Because this topic of stem cells in Robbins, it's not properly organized. There's lots of information, overlapping information, and not in the right order. I'll make it a right order so it's easy for you to remember and easy for you to read as well. Fine? Okay. Great, amazing. Let's go ahead. So let's now look at stem cells. I'm sure you must have heard about stem cells right from your school days, maybe 11th, 12th standard, and also in your first year. Comment on the chat section, what do you understand by the term stem cells? What comes to your mind first? What do you think about stem cells? Whenever you read about stem cells or hear about stem cells, what comes to your mind first? So I'm sure you must have definitely read about stem cells. So first is the definition of stem cells. When you take any stem cell in any question, first definition is required, right? I'm going to make a definition here. I've taken it from Robbins only. I'm just rephrasing it a little bit. There are two important properties of stem cells. One is this self-renewal and the other one is differentiation. These are the two important properties of stem cell. Stem cell primarily is an undifferentiated cell, right? Precursor cell is right. Can form any tissue, that is also right. It's an undifferentiated cell. It's a technical terminology, more of a scientific terminology. Undifferentiated cell, which has two main properties of both self-renewal and differentiation. There's an important definition. If you look at Robbins, what will be written in Robbins is, just give me a second. If you look at Robbins, it will be written, stem cells have the dual property of ability to self-renew and also give rise to differentiated cells. I've just added one more word. It's an undifferentiated cell, which has these two properties. So once you go to the definition of stem cell, if you look at Robbins, what will be written is, it will be talking about totipotent germ cells and totipotent stem cells. If you look at here, it talks about totipotent stem cells and it talks about your adult stem cells, and here is where Robbins talks about the types of stem cells. But again, if you look at the same Robbins in the next half, here also they'll talk about the types of stem cells, embryonic stem cells and tissue stem cells, right? There are two places where the types of stem cells is mentioned. That's why the order, like I said, it's not very clear, right? So what I'm going to do is, after the definition of stem cells, I want you to include the next thing what I want you to include in the notes making is, what are the properties of stem cells? So first, we told that stem cells are an undifferentiated cell, which has the property of both self-renewal and also differentiation. Which means I have to explain what is self-renewal and differentiation means, right? So there are two important things about stem cells. Two important things. This is also there in Robbins, but if you look at here, it is here. This part of Robbins has asymmetrical division and also it has symmetrical division. I'm ignoring these two paragraphs. I'll come back to these two. Whatever is there here, we will put it in a different order. That's all, right? So first we wrote the definition, and we are going to tell me what is asymmetrical division and symmetrical division, right? So stem cell is a very, very undifferentiated stem cell, right? It's a very undifferentiated cell. So it has to divide and give rise to daughter cell. If it divides again, it will give rise to daughter cell again. But is there a possibility that this stem cell is the one which also gives the mature parenchyma? Let's take a cardiac stem cell. Should it give rise to myocardium at one point of time or not? Or it should just keep on dividing? What is your understanding? Should a cardiac stem cell divide and give rise to myocardium, or it should not divide and give rise to myocardium? It should at one point of time give rise to myocardium, right? So there are two things here. One I call something as an asymmetric division. So what do you mean by asymmetric division is, it divides. One half will divide, that's what it says in self-renewal, and the other half of the stem cell, automatically what they're going to do is, they're going to differentiate, right? It both divides as well as differentiate. That's first property of stem cell. It's called an asymmetric division, which means a cell divides, gives rise to a daughter cell, that becomes a stem cell again, and the other division it will become myocardium. For an example, if it's a cardiac stem cell, right? The second thing is a symmetric division, which means it has only renewal. There is no differentiation here, which means a stem cell divides and forms two new stem cells, right? So I have two different functions of stem cells or properties of stem cell. One, it divides and differentiates. Other one, only divides. There are two different functions, which means these stem cells are going to be used in a different point of time in my life. Okay, I'll give you one more example for us to understand why this is required. Let's assume you have a zygote. Can I say all of us came from the zygote? Yes. So we have a simple zygote. The zygote should have symmetrical division or asymmetrical division. Should it only divide or should divide and differentiate? It should only divide because it's a single cell, right? It has to divide so much to form a fetus, embryo and everything, right? In the early part of life, it has only self-renewal capacity. It keeps on dividing again and again. At some point of time during the embryogenesis, I'm sure you must have read about epidermis, mesoderm, endoderm. That's where differentiation starts, right? In the initial part is only division. Little bit later, it differentiates to epidermal region and still stem cell rates. It differentiates to mesoderm. Again, still stem cell is there, right? So early part, it's only symmetrical division. Later half, it's a bit of an asymmetrical division. If you look at Robbins, this is also given in Robbins. The only way it is given is it's given in a different place, that's all. Okay, this is what the symmetrical and asymmetrical differentiation talks about. I have a stem cell. It divides to form a pool of cell. Some of them comes back to become stem cell. Some of them differentiates. Some of them only divides, they don't differentiate. That's what we call it in symmetrical and asymmetrical division, right? So we have two properties of stem cell which are very important, symmetrical division and asymmetrical division. Great. Now let's go to the next half. So once I know about symmetrical and asymmetrical division, we can easily tell the functions of stem cell. One we already discussed, it's about development. The entire development we came from a single cell organism. We all came from single cell, single zygote. From that we have trillions of cells in our body. So most important thing for anything is for development or embryogenesis. From a single cell to an adult, definitely without stem cell we would have not formed. Second thing, am I right in saying that every day your skin cell dies? Is that statement right or wrong? Every day in your body, does your skin cell die or they live? They die every single day, right? I'm sure at some point of time in your life you must have not taken bath, right? When you rub your skin, have you ever seen the dirt? Those are nothing but dead skin cells. So there are few cells in my body, epithelium of the skin, GIT, every day it dies. So they have to be replaced by default. That's one, right? Second, you fall down. When you fall down, you have a trauma. Should the tissue heal or not? It should heal. So can I say for healing also, I require some amount of cell division? Because I have lost a skin, I have to grow back the skin. I have broken a bone, I have to grow back the bone. There also I need, right? So the second utility of stem cell, apart from embryogenesis, is homeostasis. Whenever my skin is lost, it has to bring it back. Whenever my GIT is lost, it has to bring it back. And healing and repair, I do need them. Where this is given is, we'll go back to Robbins. Like I said, the only problem with stem cell in Robbins is the organization is a bit chaotic. If you look at Robbins here, it will be written in this part. So normal tissue without healing also, I require to maintain the cells for homeostasis because every day skin epithelium dies. At the same time, I also require to replace the cell at the time of cell damage and cell injury. So stem cell, apart from embryogenesis, it also has roles in an adult life also. Not just during a kid, during adult life also I need stem cell, right? That's a third part of discussion today. So I know the functions, I know the properties of stem cell. Now let's go to the types of stem cell. Because it's much easy to understand the types of stem cell later. But in Robbins, in the initial part itself, these types of stem cell will be there. Kamran, I will definitely come back to your question because that's an application question. It will be dealt in the later half. Just give me 10-15 minutes, I'll go to that soon, fine? So now, there are different types of stem cells. Have you heard about something called a totipotent stem cell or germ cell in your embryology? Have you heard about pluripotent stem cell in your hematopoiesis in your physiology? You must have, right? There is totipotency, there is pluripotency, there is multipotency, and there is an adult stem cell. There are multiple stem cells. I'll give you an example. What are these and what are they function? When you take a zygote, we call that zygote stem cell a totipotent germ cell or a totipotent stem cell. What do I mean by totipotency is, it can give all three germ layers and also it can give placenta. Placenta is a fetal tissue or a maternal tissue? This is a very basic question. Placenta. Fetal or maternal? Placenta is in maternal tissue, right? It's not the fetus tissue. Placenta is from the mother, right? So totipotent germ cell can give rise to the fetal all three germ layers, endoderm, epiderm and mesoderm, and also it can give rise to cytotrophoblast and syncytotrophoblast. It's very, very, very immature, the most differentiated cell, right? So once from a zygote, it matures. Obviously the zygote will grow. Once it matures, I'm taking one organ here, bone marrow. In this organ, we'll see where all the stem cells mature and what are the functions of stem cell. The most immature stem cell in bone marrow is called as a pluripotent stem cell, right? This pluripotent stem cell can give rise to all three germ layers, but no placenta. This is also a very, very undifferentiated stem cell, but not like a zygote because it has come to a specific organ, bone marrow. Then it comes to one more name called as a multipotent stem cell. Multipotent stem cell cannot give rise to all three germ layers. It can give rise to only RBC, WBC platelets, which means it is becoming specific to that organ, bone marrow. Then it becomes even more mature or an adult stem cell or a lineage specific stem cell, where I call it only RBCs or only WBC or only platelet. Understood? Samantha, I am not able to understand both placental formation. Can you please rephrase the question? I'll tell you the types of stem cell again. The most earliest one, I call them a totipotent stem cell or a germ cell, which can give rise to all three germ layers of the fetus, and also it can give rise to placenta. When we come to bone marrow, one specific organ, our pluripotent will still can give rise to all three germ layers, but no placenta. Here, next step is multipotent, which can give rise to RBC, WBC platelets, all three cells. Next, it can give rise to adult, which can give rise to only RBCs. Now, someone asked me a question, can we preserve this stem cell? Now, tell me, which of these three things you want to preserve? Pluripotent, multipotent, or your adult stem cell? Which you think is the best one to preserve for treatment purpose? Which you think is the best to preserve? Lion, pluripotent stem cells are predominantly present in bone marrow. Most of the adult stem cells will be like this. In few places, I do have multipotent stem cells as well. A PW method code, totipotent I cannot preserve because it's a zygote, right? So this is out of bounds. There's no way I can go at the formation of zygote and preserve them. So which you think is the best one to preserve? Obviously the pluripotent one is the best one to preserve, right? Because I can form any tissue from this. I can form CNS tissue, I can form cardiac tissue, I can form bone or skeletal muscle, right? So this is the best guy to preserve if I want to treat. If I want to treat a patient using stem cell therapy, this is the best guy to preserve, right? So these are different types of stem cell. I gave an example of one organ. Like this, I would have stem cell for every organ, fine? So where it is present in your Robbins is, if you go to Robbins, this is where it is present. The totipotent germ cells are also called as an embryonic stem cell, fine? The embryonic stem cell, they are seen in the inner cell mass of the blastocyst, and it is totipotent, which gives rise to every germ cell in every germ layer in my body. And then comes to my tissue stem cells. Tissue stem cells are your adult stem cells. So adult stem cells, only thing is, it will give rise to only RBC if it is RBC stem cell. It will give rise to only skin if it is skin stem cell, right? Robbins also has the same types of stem cell in the form of an image. Like I said, everything will be pictorially represented in Robbins beautifully. Look at this. Totipotent stem cell in the zygote becomes a blastocyst, becomes pluripotent. Pluripotent can give rise to everything: hepatocyte, neurons, cardiac cells, hematopoietic cells, pancreatic cells, right? Then it becomes multipotent. Once it becomes multipotent, it becomes lineage committed, either endoderm, mesoderm or ectoderm, but not the combination of both, right? So it's becoming more division and more maturation. That's the spectrum of stem cell, what they can do, right? So we know a little bit about stem cell and the types of stem cell. Now let's go to our important point of discussion now, an adult stem cell, right? So adult stem cell, like I said, they are all lineage specific, right? They are all lineage specific stem cells, right? If you look at the adult stem cell, the main goal of adult stem cell is to help in the healing and repair. The main goal is not to help in development, because once I have formed as an adult, I need not recreate thymus. I need not recreate any organ or limb. It's to healing and repair and to maintain homeostasis, maybe, probably, right? Adult stem cells, is there in particular place in every location? I'll ask you one thing. You just answer me this, then we'll go to the theory part. I'm sure you must have drawn intestine in your anatomy and histology, right? We draw intestinal epithelium like this. The superficial ones are called as villi. What are the downward prolongation called as? What are the downward prolongation called as? The superficial ones are called as villi. In an intestine, what are the downward prolongation called as? I'm sure you guys know. Comment on the right answer. Crypts. Great, Kamran. It's called crypts, right? So in the crypt of an intestinal epithelium, I have adult stem cell. It's not present all over the body. It's there in particular location. So the intestine only will renew from the crypt. Only crypt can divide more. I'll tell you how to relate it very, very soon. Fine. Again, in the bulge of hair follicle, I have a stem cell. In the hair follicle, there's a tiny bulge. There's a stem cell which gives rise to skin. Oval cells are the cells in the liver, which is seen around the canals of Herring. I'm sure you must have heard about the canals of Herring, right? And also we have in the limbus of cornea, I have stem cells. These are few locations. The subventricular parenchyma of the brain has stem cells for the brain, right? These are the locations where the adult stem cells are preserved. Now the question is, why do I need to know this information? These are facts, right? There's no concept here. I'm just memorizing it, right? Facts are not good for me unless and until it leads to something fruitful. Keep this in mind forever. If you read a fact, try to correlate with a clinical information or diagnosis or prognosis of a patient, right? I'll just give you a different question. Let's see if you are able to reply, if you're able to answer that. To treat genetic disorder, not now, we'll go to it soon. I'm having a disease. Let's assume it is causing all the villi to be destroyed. Okay, I'm having a random disease which destroys entire villi. What is the function of villi in intestine? Can you guys comment? The function of villi is simple. It helps in the absorption. If entire villi is destroyed, there is no absorption. How do you think the patient will present with? If there's no villi, how do you think the patient will present? No absorption. So everything the patient eats goes outside, will result in diarrhea. Am I right in saying that? Or a malabsorption diarrhea. Fine. So if the entire villi is lost, and let's assume I'm taking the biopsy of the intestine to see which part of these two will be bigger. Villi is completely gone. When the villi is completely gone, should my body replace it? Yes. So what will happen to the crypts? It will become bigger or smaller? It will become bigger or smaller. Whatever comes to mind answer, it's fine if you're wrong. What will happen to the crypts? What will happen to the crypts? It will become bigger or smaller? It will definitely become bigger. Can I use a term? Crypts will undergo hyperplasia, increase in cell division? Yes? Perfect. That's what I'm going to use it for diagnosis. Okay? So whenever I have a villus atrophy due to a disease, I don't see villi, so I cannot diagnose. So I use the crypt as a finding to say, okay, crypt is dividing faster because villi is gone, right? The same way here, if I have an oval cells in the region of liver biopsy becoming more and more prominent, I know for a fact some disease is destroying hepatocytes, right? So if you know the location, it's easy for me to diagnose in the microscopy. That's why these locations are required, and where it is present in Robbins is, if you go to the Robbins, it will be there under the adult stem cells, okay, the tissue stem cells. In these parts, you will have all the information what we discussed till now, maybe a little bit more as well. We call them stem cell niche. Niche are tiny little bit areas, right? You have in the bone marrow, I have stem cell niche. I have in the bulge of the hair follicle, the limbus of the cornea, subventricular zone of the brain, and also you have in the perivascular niche of the bone marrow, you have the stem cells, right? There are multiple stem cells here. And there's a pictorial representation also of the stem cells. If we go to the next page of Robbins, if you look at this, crypts. You have the stem cells, the Paneth cells and everything. This is the liver biopsy, canal of Herring, that's a stem cell there. And you can see here the bulge in the hair follicle, right? These are the pictorial representation. You can either draw this or write pointwise. I would say write pointwise. Drawing might not be required from an exam point of view, right? So I know the next part as well. I know the types of adult stem cells, we know the properties of stem cells, and we know the different types of stem cells, right? Now the goal is, many of you said that I'm going to use stem cell for therapy. I am sure when you read newspapers, every now and then something pops up, stem cell therapy, the patient recovered and everything, right? So the stem cell therapy, using stem cells for therapy, we call them an regenerative medicine. Okay? This is a new term, might be new term for some of you. I use the term regenerative medicine if I'm going to use stem cell to regenerate any part of my body. Right? It's not so easy like we think. There are few problems. At the same time, I've got few successful results as well. First, we'll talk about the success. Right? Because stem cell can repopulate the entire damaged tissue, or it can repopulate the entire organ itself. Right? So, can anyone tell me where have you before heard about stem cell therapy? In which condition, in which organ, whatever comes to your mind? Anything which comes to your mind? Any organ? Perfect. Lioness said bone marrow. Did anyone come across anything else? Liver stem cell therapy is a bit unlikely, Kamran. Bone marrow, yes, definitely, I'm sure you must have come across. Have you come across this? Hair loss, and you have stem cells put into the hair and the hair starts growing. SCID, yes, for sure. Again, it comes to the bone marrow at the end of the day, right? Heart, again, stem cell therapy is a bit difficult. Yeah, there are research which saying, but in reality, it's a bit difficult, right? PRP, right? That's also kind of a stem cell regeneration in your hair follicle, fine, perfect. So now, one of the success which I've got is bone marrow transplant. So what I do primary in bone marrow transplant is, especially in a patient with leukemia, myeloma. These are two places where it's commonly done. Myeloma is a cancer of plasma cells. You must have heard about plasma cells, right? So in these cancers, what I do is, let's assume there's a patient with multiple myeloma or a leukemia coming to the doctor. They'll give chemotherapy. Will destroy the entire bone marrow. Take the stem cells alone and give it back. So the stem cells can repopulate or regrow the bone marrow without the cancer. That's the idea, and yes, we have achieved good amount of success. But there are few problems here. In bone marrow, it is a bit easy, but there are few problems. Let's look at the problem statement, and that gave rise to one more important observation and improvement here. There are two problem statements. Bone marrow is a bit easy. Tell me, you have got a liver stem cell, or let's assume crypt of the intestine. How do you think you will put that intestine into it? The stem cell into the intestine crypt. Is it possible, easy, or difficult? Med code, I'll answer your question soon. Samantha, multiple myeloma is a cancer of a blood cell called as a plasma cell. If I have a stem cell of the crypt, is it easy to put the stem cell into the crypt or difficult to put it? Bone marrow is a bit easy because when I put into the blood, it goes to the bone marrow. It's very, very difficult to put, right? That's my first statement. It's very, very difficult to introduce the stem cell into the body. Even if I introduce it, the cell should go and sit in the crypt and attach to the crypt and function, integration. It's very difficult. Blood is easy because once I inject into the blood, it rotates, circulates and goes to the bone marrow. But for a heart, very difficult. Heart is beating so fast. How do you think you can insert a stem cell into the myocardium? Very, very difficult, right? Biggest hurdle for me is the introduction of the cell and integration to the sites. That's one of the biggest hurdle. Second biggest hurdle for me is, not just cell receptor problem, it will not even go and sit there. Let's assume I am putting cells into the oral cavity. It will get digested first. I have to give away blood only. If I have to give away blood, it's a single cell. It cannot go and sit exactly in the crypt where I want to. Very, very difficult to do, right? Second problem is rejection. We only discussed that quite some time back. The best cell for me to use for replacement is pluripotent stem cell, right? I'm going to ask you a question. Pluripotency gives rise to all three germ layers or only one lineage? What do you mean by pluripotent? We read that. What do you mean by pluripotent cells? All three germ cell or only one lineage? All three, right? Perfect, Abbas. All three things. Amazing. So can I say, if a cell has the capacity to give all three germ layers, it will have the antigen or HLA complex of all three? Is that right? If it can give all three germ layer, will it have the antigen of all three? It will have? It should have. That's my problem. It can divide to anything, which means it will have the antigen of everything. Let's assume I want to put a stem cell in my hand. If I put a kidney here, do you think it will reject or it will hold? It will reject. I want to put a renal transplant. In that, if I have a skin antigen, do you think my body will reject or it will hold? It will reject. That's my second problem. Because pluripotent stem cells are the best cell for stem cell transplant, but they have lots of antigen and HLA receptors of all the cell types. So there will be very high chance of rejection. Nayak, we'll discuss that sometime later or maybe at the end of the class, fine? Right? So rejection is a huge problem. I need pluripotent stem cell, but the rejection is a concern. So for that, we modified a little bit. The modification is an amazing modification. Now, tell me if I'm right in thinking. I need the property of pluripotent stem cell, but I don't want the unwanted antigens and unwanted HLA, right or wrong? Because if I have that, rejection will not happen. Yes? The property is amazing, but no antigen, right? Which means to get a NEET PG first rank without doing any hard work, something like that. Like that, I am presuming I want a cell, right? So what we did was, we did a modification, right? So this pluripotency is given by genes. I am not going to name the genes here. There are few genes which gives stemness to a cell. Okay? There are few genes which can give stemness to a cell, right? That's available to me. I know the genes also. So what we did with these genes is, I introduced the genes into a normal adult cell. I'll just going to give you an example of something called an induced pluripotent cell. This is also there in Robbins. I'll go to this, we'll finish this and then go to Robbins, right? Let's assume I had a damage to my hepatocyte. Our hepatocyte underwent damage, it was damaged, I need to replace them. So what I do is, I take the same person's adult hepatocyte. This adult hepatocyte will have the property of only liver, or it will also have the property of kidney, heart and everything. It will have the property of only liver. It won't have other property, right? So to this adult stem cell, if this happens in the lab, okay, I add the genes for stemness. It's an adult hepatocyte to which I am adding genes of stemness. So this adult hepatocyte behaves like an pluripotent stem cell, but it will not have the antigen of kidney or heart or CNS, right? That's one amazing thing. In this way, I can replicate the liver without rejection. Because here rejection will not be a problem, because it's a liver cell, it's a liver's antigen, liver's HLA, but the property alone, it can divide like a pluripotent hematopoietic stem cell, right? That's an amazing thing. But again, one more problem is there. How do I put the cell exactly into the liver? That's a concern. We are still working on it, because stem cell therapy and regenerative medicine is in very, very early stage. These are things which have been done till now, which is there in Robbins and which we covered it, fine? Let's go back to the book and read about that, right? So we know about all the stem cells, and this is where your regenerative medicine starts, fine? The second topic below the stem cells, you have the same thing, whatever we read will be discussed here. So what is the scope of regenerative medicine is the first part. I can replicate, I can even form an entire organ, but there are few problems for sure. One, we talked about the HLA and the immunological region. That's the one biggest problem. Second is integrating and introducing the cells into the location is very, very difficult. These are two main problems of any stem cell therapy what we do, but integration is still difficult. This rejection we have taken care of. That's where if you go to the next image, it will be written. You have a patient cell, an adult cell, you take the genes for stemness, culture in the lab, make an induced a pluripotent stem cell, and then you can do whatever you want, right? So induced pluripotent stem cell or IPCs are very, very good, which will help to avoid the rejection. But still, the location and the integrating the functionality is still a problem in stem cell therapy, fine? So that's about stem cells. Any doubts? Let me know. Okay. So now I'll just go and revise quickly whatever we read, fine? So what we read about stem cells is, first the definition. It's an undifferentiated cell which has the capability to both self-renew and differentiate. After definition, we didn't go in the same way as Robbins. I just talked about asymmetric division and symmetric division, fine? Priyasing, I'll answer your question. Lion, I'll answer your question. Just give me some time, fine? Asymmetric division means it can renew and come back to the stem cell pool, and also it can differentiate. Symmetric division means only renewal. Symmetric division will be there in the very, very early part of the zygote. Asymmetric division happens when my zygote and the fetus matures a little bit, right? Which means I have different functions of the stem cells as well. Development, that's embryogenesis is one important function. Not just that, to maintain hemostasis, whenever there's a damage, to replicate also I require that. To repair also I require that, right? So the types of stem cell, very, very early on in zygote, I have something called a totipotent stem cell or germ cell. All three germ layers plus placenta, and when it comes to any particular organ, initially it's pluripotency. Pluripotency can give rise to all three germ layers but no placenta, then becomes multipotent, which means it will produce only that organ. Since we took bone marrow, RBC, WBC platelets. If I take an mesenchymal tissue, it can produce adipose tissue, fibroblast, muscle and everything. That's a mesenchymal multipotent stem cell, fine. And we have an adult stem cell which will produce only RBC here, fine. So our concern was, where are these present? A few examples I told you, and also I told you how do I correlate them. Because if I'm not able to apply a fact for diagnosis, don't remember the fact. Crypt hyperplasia will happen in any condition when there's villus atrophy, right? And we have something in hair follicle bulge, limbus of cornea, and in the liver, fine. And the treatment is, one of success is your bone marrow transplantation leukemias, but we do have a little bit of problem statement. One is anatomical integration, other one is the rejection. For rejection, I have the inducible pluripotent stem cell, where I take the cell and give the genes which produce stemness. I will now take your queries. Lion stemness means, yes, it has the property of the pluripotent stem cell. I am just going to give the genes which makes any normal cell gives rise to a stem cell. We are saying steroid side of vitiligo is an autoimmune disorder. Okay, treatment might be steroids, but steroid side effect is not vitiligo. Samantha, pathology by Ranjith here. Okay, MK is amazing question. How does an IPS gives rise to only liver? Very good. Now let me say it's a pluripotent hematopoietic stem cell or pluripotent stem cell, right? For this pluripotent stem cell to give rise to an bone marrow, it needs few growth factors. For it to give rise to hepatocyte, it needs few growth factors. So what I do is, all this happens in the lab. I take an inducible pluripotent stem cell and I give hepatocyte growth factor alone and not give any other factor. So it will produce only liver. If I want cardiac protein from the pluripotent stem cell, I will give only that growth factor, so it grows only to heart. I hope your query is sorted, MKS, right? Okay. So stem cell therapy is a very, very interesting therapy. It's a very new field, developing at a very fast pace, but very new, which whenever something is very new, we are not confident about it. Effect might happen, might not happen. You might give a stem cell therapy to one person, it might respond very well. Same therapy, another patient, it might not respond. You are not able to answer now, maybe in future you will be able to answer. Okay, Samantha, difference between vitiligo and albinism. Vitiligo is an acquired autoimmune disorder. Albinism is a congenital disorder. I am sure you must have read about albinism in your oculocutis albinism in your biochemistry. There are a few congenital disorders, right? When the DOPA decarboxylase enzyme is absent, albinism happens, fine? See, if I am going to take a stem cell, induce stemness outside the body, it's a gene change. So the genetic change will not change. Once I introduce them into the body, it will replace it. Let's assume I have replaced the entire liver. There's no more stimulus for the stem cell. It will not do anything, it will stay there, that's all. I hope that answers your question, Kamran. Okay, Nayak, your question of, let's say that I gave an example of one patient has a cancer, leukemia. I am giving chemotherapy. I am destroying every cancer cell. Then only I am going to replace it. When I replace that, it most likely will not form cancer, but yes, there is a slight amount of chance of recurrence that will happen. That's a part and parcel of any treatment what I have, there's an adverse side effect. I'll make sure that's becoming good PSM shots. Lion, we will read Warburg's effect when you come to neoplasia, because in Warburg's effect in your stem cell cycle, it will be only one line given. It's an entire page of discussion or 2 pages of discussion in the neoplasia chapter, we'll understand that time there. Meded code, English is difficult, bit difficult, fine. Please ask a question in Hindi, I'll try to go slowly and answer it. Steroid overdose will result in thinning of the skin and it will cause break of the skin. That's what will happen, fine. Okay, so that's about today's lecture. I'll give this notes what I have written for you for stem cell in the Telegram channel. Please have a look. Few places in Robbins, it's a little bit more chaotic. You have to rearrange them, but don't skip them. Just rearrange them, make a format. It's much easier for you to understand in this format than going with the format which is there in the Robbins pathology, fine. Lion, I have a class tomorrow. I'll be talking about intracellular accumulation and lipid metabolism. Fine. Okay, let's learn slowly and steadily throughout the year, maybe if possible. And we have to make sure we'll read Robbins. And please tell to your juniors, they have to read only standard books. So the problem is your seniors said Robbins is difficult, right? You tell to your juniors Robbins is easy. So that forever down, every MBBS doctor will read standard books and make Indian medicine to the world level. Fine. Thank you. Bye-bye. Bye.